Here we're presenting a mesenteric lymphoma in a 52-year-old man who presents with bulky diffuse large B-cell lymphoma, 11 centimeter, involving the mesentery and para-aortic region. He received 6 cycles of R-CHOP and achieved a metabolic complete remission with a Duvel 2, and now he's presenting for consolidation radiation therapy to the original site of disease, and we're going to do ISRT to a total dose of 30 gray. The CTV here is showing how we go about fusing, although as you might expect that fusing is helpful, but sometimes because the different treatment position as compared to the diagnostic imaging might be challenging on how to fuse these organs, eyeballing back and forth might not be a bad idea. So the planning CT that you see here is done using breath hold technique to decrease the respiratory motion, specifically that the kidneys moves up and down. And then once you plan, those kidneys are gonna move in and out of your field. Therefore, if you wanna record a stable and a reproducible dose to those kidneys, breath hold would be very helpful in this case. NPO also is very important, since when the patients are not NPO and the stomach is expanded, it actually pushes the kidneys down, and it might push the kidneys into your field unintentionally. As you can see here, this is the CTV, and when you compare it to the pre-chemo volume, it's much smaller because that expansion of the tumor, which has a non-rigid contours, it does not invade into the organs around. And once it responds to chemotherapy, it deflates like a balloon. For that reason, and when you compare the pre-chemo to the CT area, what you're trying to do is off the great vessels, off the kidneys, and just going into the fat where these lymph nodes has been sitting. So there is no point of neither including the vessels unless you're going after the fat here where you saw that there are lymph nodes, nor the kidney, because although you could see here as if it was invading into the kidney, but the reality is that there was a fat plane here and it was not going inside the kidney. Therefore, we do not include any of it in our CTV. This is another view of what we're talking about. And again, when you compare, you could see how we chase just the fat around the area where the para-aortic lymph nodes usually sits. You can also see how the kidneys move between having a breath hold in the case of the CT SIM versus not having a breath hold in a diagnostic CT or in a PET scan. So you can see how the kidneys positions has changed. So it is very helpful to have a breath hold. This is a coronal view to show also how thin the CTV is compared to the pre-chemo volume, but also to show you that up and down vertically, you're actually chasing the tumor or the sites where the tumor originated from, with the upper border and the lower border. That's another view of how we chase the tumor up and down, but then the transverse diameter is thinner because when the tumor went down with the chemotherapy, it deflated like a balloon. The IMRT used has to be done with no lateral beams because, again, homogeneity of the plan is not as important as in other malignancies where you have to use a dose that sometimes is double the dose that we use in lymphoma. And what that gives you is a plan that, as I said, is not that homogeneous, but again, you're only using 30 gray. It gives you an excess dose to the bowels that is very tolerable. It avoids the kidneys that the patient might need in the future in case they need further chemotherapy. And you can see it both in the coronal and axial views, and you can see that the 5 gray line, which is the deep purple, is of those kidneys. The DVH again reflects what I showed you from the isodose line display. And the take home message is that treating abdominal locations is possible when being mindful of organ motion. Tools to reduce interfraction motion include deep inspiration, breath hold, as well as treatment with an empty stomach, NPO for at least 6 hours. IMRT, while avoiding lateral beams, will offer a conformality or an acceptable conformality while keeping critical organs way under constraints.